Hi guys, welcome back to my channel. My name is Ruth and today's video is going to be about study tips for pharmacology. Before I go into this video, I would like to say thank you to my viewers and my subscribers for coming on here to support me. So if you're interested in getting some study tips and test taking tips for pharmacology of nursing, then stay tuned with me. And I do understand that some schools, unlike my school that has a pharmacology class by itself, does not have a separate pharmacology class by itself. Some schools have it embedded each semester into classes you take throughout your program. That's what I understood from some students from other schools. But hopefully the tips I have in here can be useful to you as well, no matter how your pharmacology is presented. So let's go ahead, guys. My suggestion for studying would be like focusing on nursing considerations. And by the way, I have my notes as usual, so if I'm bending my head down, I do apologize. I will try to keep eye contact with you guys. So focusing on nursing consideration for each drug is very important because it involves you getting to know how the drug affect the patient and what we as nurses or incoming nurses need to focus on to protect this patient as they are receiving this treatment. And also focusing on in your book, or like our book had areas that said nursing considerations, so focus on those points for the drug. And there are now a lot of critical thinking scenarios for every drug or each drug, but in each like classification of the drug, you might have some drug that they might have critical thinking scenario of those drugs. If the book has a critical thinking scenario of a specific drug and it is listed among those prototype that you are supposed to study, go ahead and consider the critical thinking. Go through the scenario. It has similar information like your nursing consideration, but this one put it into a patient's perspective. For example, it will say the patient has XYZ disease and they are treated for this with this medication, and then they will tell you things about it step by step like the assessment, your diagnosis, your implementation, your planning, your implementation, and your evaluation. So it's good to consider that, and at least for me, I saw it as a way of me knowing exactly what this specific drug is used for. Sometimes it will tell you the age of the person, all of those things. It was helpful to me. And another thing I observed when I was studying, most fast-acting drugs, not all, but most fast-acting drugs were like given through IV. So say on a test you ready for, because sometimes the test you study is a lot of material, so I will come to that later on, hopefully, if I don't forget. But it's a lot of material. Let me just peel it out there. You might get it mixed up, but if they tell you sometimes like a patient is brought to the emergency room for XYZ problem, they give so and so medication, the nurse will know that this was given by what route. Your best guess, not always, will be or could be by IV. If IV is a choice and you just completely forgot about the drug route, go for it. Because if you see emergency or acute words like that, it might be that medication might be given through IV. Like I said, it's not for all drugs, it's different, but for the most part, that's what I observed. Also another one of the things that we learned about was insulin, and you have to know your onset, your duration, and all of those things. It's kind of a little complicated, but there are good videos on YouTube, like Sarah, registered nurse RN, and some other videos that has mnemonic and stuff. I can't remember the other one I watched. I was trying to look it up before I do this video, but I just totally forgot. But there are mnemonic that can help you to remember not just the insulin route, but other drugs, how to like um remember them. It makes studying easy for you. So if you have extra time on your hand, it's a good way to help yourself remember those drugs. Because like I said, it's a lot of drugs, especially if you are doing it as a whole class for a semester. It's a lot of drugs. So check out her videos, registered nurse RN. She has really good information. Um or you could Google stuff too. Mnemonics, pharmacology mnemonics. But I got a lot of helpful tips on YouTube. And then for insulin, I might make a video later on my own way that I ended up studying it, and that made most sense to me. I might make a video about it in the future, but for now, use those resources. As you study, like I said, you focus on nursing considerations, and nursing consideration involves like your assessment, your diagnosis. For assessing, read those things you need to assess on the patient for a particular drug. And there are some things that are like flagged depending on if the question asks about if the patient just came into the facility, or if it's a patient that has been with you already. So it will determine whether you're doing focus or general assessment. Um, then for the diagnosis, because there are questions that could come. I'm sorry, you guys. This going to be overlapping for both test taking and study tips. So for diagnosis, you want to hold on one second. Okay, you want to study the system or the body parts that this drug affects. Focus on that, because most questions will tell you things about related to XYZ. So whether it is like, when I say system, I mean like the GI system or the CNS or your heart, the cardiovascular system, and all of those things. So each drug might affect different thing or different part of your body. So know what part of the body, which part of the body is affected. So if you see, sometimes if you see a diagnosis, it may even tell you what the problem the patient is facing. But then at the end of the sentence, you will see that it's not a part of the body that you study. That's how people get thrown off. It makes that particular option wrong for you. It won't be a good answer choice for you. So remember what part that drug affects in regard to you knowing whether that diagnosis is correct or not. And sometimes they will throw in question like about deficient knowledge. It's a diagnosis. But most times what I observe, if it's a deficient knowledge, that patient, from the scenario, that patient might have been, maybe the patient is, if it is the patient's first time taking this drug, or the patient is, it is the patient's first diagnosis of this particular problem. Then deficient knowledge related to, would be a possible answer choice. But if it's not the case, if the person has chronic problem, which is long term, the person already might know about this. You are not the first nurse or doctor or whoever they are meeting with. So deficient knowledge will not be an obvious answer. Then when you come to planning, which is part of your nursing consideration, you want to focus on achieving therapeutic effect. Those are like clue words that make you feel or know that this is a question about planning. And you want to Also, part of your plan, you want to also try to limit adverse effects or provide safety and comfort measures for the patient. Those are things that are included in your planning. So if you remember those things, basically it guides you into not choosing wrong answers, and also knowing, understanding the drug. Like, what am I supposed to plan for this patient that is taking XYZ drug? And also, some drug have specific points that you have to consider as a nurse. Remember, if there's something unique to a drug, try hard to remember it, because most likely they're going to ask you on unique things to that drug. Um, then for implementation, that's the juice of your study, because that's your doing part as a nurse. So you want to know what you need to do, and your implementation is guided by your planning. So it works hand in hand. When you're implementing, you want to learn and remember those important things about each drug. Like I was mentioning, unique things about each drug, whether you have to give the patient the drug or teach the patient that they need to take this drug at bedtime or in the morning, or with food, without food, those kind of things, whether they should not use grapefruit juice and all of those kind of things, or if they should space it like an hour or 2 hour with other drugs. You need to remember those things. Those are things they ask about. Then you come down to your evaluation. For evaluation, you want to just see if whatever you have planned and you implemented, if it yield result. And if it did not yield result, it's not a bad thing. You're just going to start that entire nursing process all over after your evaluation. So it's a continuum. Then so basically I'm like done with the most detailed stuff. But something some students use, and I tried to use at the beginning of my semester, was doing drug card. But it was a lot of work. And not just because it was a lot of work. It was very useful, but I didn't find myself find it very handy for me. Some people, I see a lot of my schoolmates, they have drug cards, but drug cards were just like all over the place. I have to be flipping. So I thought it was too buggy for me. So at some point, what I started doing was this. I would make a plain sheet of paper like this. Whatever chapter I'm dealing with, like for instance, this is chapter 47. I don't know if you guys can see it. 47. I will just write chapter 47, draw lines to separate them. Each place where you see the line is one drug. It's the same thing I could have put on a drug card. And whatever you see highlighted, like this is the name of the drug, this is the class, the name of the drug. So I will do like that, and then as I study important things from my nursing consideration, I will highlight them, so that even like right before the test, the night before the test, all I'm doing is just reviewing this. I don't go to my book anymore. So if drug card works for you, that's fine. But for me, just writing this, see, I have 47. Just it has 1, 2, 3, 4, 5 drugs. This is for my extra note. Then 48. So I have 2 chapters right here on just one page, and it was very handy for me. I took it to clinic because sometimes when on break, I will be going over my drugs, testing myself in my head. It was a better way to carry it because I'll just pull it up. It fills the same space, or it's bigger than a drug card, but my scrub pens has a big pocket, so I will keep it in it. So that's how I did my drug. I didn't continue with drug card to the end of the semester. I just couldn't coordinate it, honestly. So I still have some tips here. I said it was test taking tips that I wrote, but pretty much I have already talked about. I have mixed it up with the study tips, but let me see if there's anything different that I need to let you guys in on. So here I have, okay, for study tips, I have something in here. When test taking tips rather, you look for keywords when you're studying. so that you can know which drug is being asked about. Because sometimes, because there's a lot of drug to study, you might get confused, have it all confused in your head. But if you see keywords on the test about a certain drug, and if you focus as you study, it helps you. As soon as you see it, you won't even let something else trip you off from that answer choice. um and it's just pray that as those questions being asked can be asked in a way that gives you clue, or that you see it and signal out what really they are looking for, or they are written in a way that makes sense to you. Because nursing school question can be a little bit tricky, even though some of my instructors will say, we are not trying to trick you guys. We ask you what to teach you, but hey, I haven't come to that agreement yet with them. But hey, my opinion doesn't really count at this point anyway. Um, but yeah, this is my study tips and test taking tips. If you have any more to suggest to help someone out there, go ahead and put it in the comment section. And if there's anything that I left out too, yeah, I want to learn something new. Support this channel for me, please, you guys. I love you guys so much, and I will talk to you guys again. Bye.